Welcome back. It's time for our Thursday Health Report. Joining us now is Africa 54 Health correspondent Moudou with new information in the fight against Ebola. Lino?
Hello, Vincent. Well, Guinea's President Alpha Condé has announced a new emergency measures in one more attempt to contain the Ebola outbreak. The country has embarked on 45-day emergency measures to fight Ebola. This will enable authorities to restrict movements in Western Guinea, where Ebola transmission continues a year after the epidemic was declared. Following a dip in new cases in January, cases of Ebola have spiked again since early March in and around the capital, Conakry. This has prompted officials to announce a new phase of the epidemic in Guinea.
We had almost managed to beat the virus. It had started slowing down, but recently we have seen a resurgence and a rise in the number of new cases, especially Western Guinea. At the beginning, when the virus first started, it was mainly concentrated in the forest, but has now subsided.
It's a serious disease and extremely dangerous for the population in the region. We must all fight this Ebola disease. We must do everything so that we can beat it.
And some observers say the latest spike in Guinea's Ebola cases could be a sign that aid teams are at least gaining access to hidden patients rather than a surge of new cases. Now, as part of its efforts to stop the spread of Ebola, Sierra Leone officials are sprucing up an outdated police garrison to house Ebola quarantined families who don't have a proper place to stay. Workers are busy renovating the old police academy barracks in Hastings, Western Sierra Leone. It will serve as shelter for families on quarantine for Ebola until they are deemed safe to go back to their homes. Fear and stigma has driven many families out of their homes after being in contact with relatives who contracted the deadly virus. Mohamed Saido Karama and his family are now housed at the barracks after his father was diagnosed with Ebola.
My landlord, as soon as he heard that my father was positive, he became annoyed with me. Even that night, I went to the police station and report, and the police officer told my landlord to let me stay for the night. The morning, some under NGO come around me, and then they call. They said they are going to find a quarantine place for me and my family.
The United Nations Mission for Emergency Ebola Response, UNMIR, together with its partners, is working to provide funds to renovate the dilapidated buildings. The facility is located next door to the PTS-1 Ebola Treatment Center.
We provide them with comfortable place to sleep, bed nets, toiletries, 4 meals per day. We even give them hygienists to take care of their place.
Guinea, Sierra Leone and neighboring Liberia are battling to stamp out the worst Ebola outbreak on record. The epidemic has killed more than 10,000 people during the last year. Quarantining people is one of the methods governments have used to help stop spread of the disease.
When they are here, we don't allow people to get contact with them. We restrict visitors. They only come, they stay far, talk to them, but we don't even allow visitors here.
Ebola is transmitted through any type of bodily fluid, including from the blood of people showing symptoms of the disease. Liberia, once the hardest hit of all the countries in West Africa, has detected no Ebola cases after the last confirmed patient died at the end of March. Guinea has imposed a 45-day state of health emergency to tackle a recent spike of cases in the country where the outbreak was first confirmed early last year. And that's our Africa Health Report for today. Back to you, Vincent.
Well, thanks a lot, Linord. Be sure to watch Moudou's Health Reports every Tuesday and Thursday right here on Africa 54.